doing today?
I'm doing okay.
So today I see you came in because we have some sensitivity on your back tooth every time you eat sweets. Is that correct?
Yeah.
I see you have a plaque score of 3.5, which is considered poor, but we're going to work on that. And you have a bleeding score of 62, and we're going to also work on that. That's why we have the long-term goals and the short-term goals. That you have some cavities as well. So walk me through your daily routine.
So I brush once a day and I floss sometimes, but I don't brush my tongue at all. And I drink Dr. Pepper and caramel lattes, and I use peppermint to get that taste out of my mouth.
Okay. So we have 3 long-term goals, and we have short-term goals in between to get to those long-term goals. So our first long-term goal is to decrease and maintain plaque score to 0.5 or less by your next visit. In between that, our short-term goals are to have an understanding of what plaque is by this visit, and to decrease plaque score by 1.0 or more at each visit, and to demonstrate proper brushing technique by this visit as well. Our next long-term goal is to halt the progression of periodontal disease by reducing the bleeding score to 0 by your next visit. In between those are our short-term goals. Understanding what periodontitis is and the causes of periodontitis by your next visit, reducing bleeding scores by 20% at each visit, and demonstrating proper flossing technique and start flossing once a day by your next visit. Okay, so we have our third long-term goal, which is having your caries lesions restored by your next visit. Short-term goals in between those are to understand the causes of the caries, which is cavities, and the relationship of your diet. Our second short-term goal is for you to make an appointment with us to discuss and have your caries, which is cavities, restored by your next visit. And then the third short-term goal is for you to be placed on a fluoride rinse by your next visit. Okay, do you know what plaque is?
Actually, I've never heard of it.
You don't know what that is. So do you know how it forms or?
No.
No. Okay, so plaque is a biofilm, which is bacteria. That's a biofilm made up of bacteria that is soft and sticky, that sticks to your teeth, and it kind of forms around your gum line of your teeth, like on the front parts of your teeth, behind your teeth. You ever notice like that little sticky white stuff that you can kind of get off? Yeah, you kind of see it. If you look at the slides, you can see how plaque actually looks. You can get a better visual of it. Do you know how fast plaque forms on your teeth? No. Okay, so after you brush, plaque actually forms 4 to 12 hours after. So that's why it's important to brush twice a day to make sure we're getting all that plaque off. Okay, so what is the purpose of removing plaque to you?
To get your teeth clean?
Yeah, that is correct. And also because bacteria and all that plaque and bacteria that can build up on your teeth can cause inflammation and have your gums red and can bleed, and that could be a further problem. So I'm gonna ask you some questions dealing with what we just talked about.
Okay.
What does it take for plaque to build up on your teeth?
4 to 12 hours.
Correct, that's correct. And do you know what plaque is? We're gonna
I remember you saying it's like that sticky deposits that form over your teeth.
Yes, correct.